inviting me to the Policy Dialogue, Delhi Dialogues of Policy Circle. Indeed, a privilege to share the panel with all of you. So my role here is to speak about the government schemes, and we understand that there are a lot of lacunae at the grassroots. There are some, I mean, it's a lot, but there are lacunae in last mile implementation of government programs. So we would take cognizance of that, but I would just first like to take the narrative with beginning with what the government is offering and what is the problem. First of all, what's the problem statement? Of course, Vandana has already explained it in great detail at the grassroots what is the problem. So I'll just kind of elaborate at the macro level and then go towards what the government is doing, Government of India, as well as some of the iconic works done by some state governments, and how could we improve the implementation of the outreach? Because as part of my work, I lead a lot of Government of India missions, so I understand what is the practical difficulty in implementation of Government of India programs. So, as has been stated by Vandana just now, that the COVID-19 has of course really impacted negatively the child malnutrition phenomenon that is there in the country, and this is because of two-pronged reasons. One is the overburdening of the health systems, which has impaired the service delivery, and of course the economic impact of the pandemic, which has reduced the frequency and quality of meals consumed by the households. And it was also predicted that the child malnutrition could have increased by about 10 to 20% because of COVID-19, and an additional 6,000 children could have died every day because of from preventable causes because of disruption in health services. So, and food insecurity is not just detrimental to the long-term health of children, but also to their cognitive and learning abilities. So that's taken cognizance of. And of course, the financial constraints have also led to people moving towards cheaper and less nutritious food, as we all know, because nutritious food is estimated to be about 10 times more costly than staple food. And the PDS also, it's just the recent, so the PDS outlets have also been stocking monocrops and staple crops, not giving a balanced basket of diet. So, to which the government has responded recently with the fortified rice scheme, where the rice is being fortified with vitamins and B12, etc. And so there has also been an attempt to stock the PDS with these fortified rice, and various state governments have also taken steps to have a balanced basket of diet, which includes more nutritious food in the PDS outlets. So that has been one of the reactive efforts of the government towards this lacuna that is there with the PDS outlets. And also, of course, as mentioned by Vandana recently, I mean, just now about the digital divide and how PDS outlets also, we have to have the ration cards linked to the Aadhaar. That we understand has created a lot of grassroots level issues in linking the Aadhaar with the PDS, with the ration cards, etc. So, for which the government responded with the one nation, one ration card scheme, which has also been pretty effective in terms of reaching out to 24 states and union territories and covering almost 80% of the NFSA, National Food Security Act beneficiaries. And of course, the migrant workers. The first lockdown, we saw the whole the distress migration that was happening across cities towards rural areas, and how the migrant workers couldn't plug into their ration card provisions in their native states, for which again the government responded with the ONORC, and which has been effectively implemented to a large extent. And the other big problem that stares at our face in terms of which indirectly or directly contributes to child malnutrition is, of course, the vacancies in the grassroots level, primary and secondary health centers. So this is the broad layout of the problems that exist at various levels in this scenario. So, but if we just look at what the government of India has been doing in 2015, of course, we committed to achieve the Sustainable Development Goals of Zero Hunger, towards which the Prime Minister's overarching scheme of Poshan Abhiyan was launched in 2017, which had the targets were to reduce stunning, undernutrition, and low birth weight by 2% and anemia by 3% by 2022. And the large programs were the Supplementary Nutrition Program and the Anganwadi services and the MD midday meal programs. So which actually have, as data goes to say that it has benefited almost 64 million children in the age group of 6 months to 6 years and 115 million school-going children in classes from 1 to 8. In the recent budget, of course, S&P has been merged with the Poshan Abhiyan to come out with the Mission Poshan 2.0. And so the two main programs that exist today are the Saksham Anganwadi and the Poshan 2.0 with a budgetary estimate of 20,000 crore for 21-22. So that's a lot to look forward to. Again, we have to see how it's implemented and how it reaches the grassroots. And also as the Azadi ka Amrit Mahotsav festival, I mean, the whole celebration towards 75th year is ongoing. And this is September month, which is the Poshan Maha or the Poshan month, where a lot of activities are being undertaken across states at the grassroots level towards improvement of child nutrition, like distribution of nutrition kits, etc. And all of this need not be taken with a pinch of salt because such festive drives actually contribute a lot in actual implementation of flagship programs at the ground level because it caters to popular sentiments of the people, and so that it helps improve traction and implementation of such flagship programs. And of course, a Poshan Tracker application has also been rolled out by the Ministry of Women and Child Development, which is going to be monitoring and tracking of the nutrition strengthening approach at the Anganwadi centers and service delivery of Anganwadi workers, as digitalization and encouraging or dissemination of digital platforms is one of the USPs of this particular government, and it's going on, but with a lot of course, implementation challenges. But I think it's going on at a rapid pace. And of course, the closure of Anganwadis has led to a lot of disruption in services, and for which the government responded by provision of dry ration to the households, and also substituting the increased, cooking gas benefit by actually direct provision to the children, a direct provision in kind with food grains as food security allowance, rather than transfer the amount to their parents' bank accounts. And of course, Ministry of Child Health and Family Welfare has also issued directions to states on provision of reproductive, maternal, newborn, child, adolescent health plus nutrition services during and post COVID-19. And this included home delivery of IFA and other essentials like ORS, etc. And the recently announced centrally sponsored scheme of the fortification of rice and its distribution under the PDS system for 3 years is also a significant program which 9 states have adopted, and districts have also been identified in 9 states, and it's going to be spread across the country. And of course, central government has also been, in terms of distributing the diet kit to move towards more value-added foods. There has also been a move to increase the production of millets and introduction of millets in PDSs since 2018. And if we look at some of the iconic works of some of the state governments, we've had the Jharkhand government coming out with the Mukhyamantri Dal Bhat Yojana, wherein subsidized cooked meals were distributed through community kitchens, and the Annapurna Rasoi in Rajasthan, the Aam Aadmi Canteen in Delhi. And of course, Kerala, Uttar Pradesh, Maharashtra, Odisha, all distributing kits and nutrition kits, and also a complete monthly kit to households through their distress funds and various other funds. So there have been these various efforts taken by the central government as well as the state governments, comprehensively trying to address the issues across board. But of course, the last mile challenges remain. And so if you really want to plug the last mile challenges, the answer is to one is, of course, to see how every Gram Panchayat can be saturated with all of these missions that the government has rolled out. There are a plethora of programs that the government has rolled out, Government of India and even state governments following suit. But it has to be seen how every Gram Panchayat or every household can be saturated with all of these programs to cater to every problem that every household faces. So if one does that with a drive and equipping the last mile administrative unit, which is the district, the block, and the Grama Panchayat, with adequate professionals, with adequate human resource, and with the adequate skills given to the officers there to implement these programs and to also be able to discern what is required to be formulated with all the funds that is flowing into the gram panchayat, the blocks, and the districts. So that is a very essential step required to be done, which we've been saying for the last 20 years. But of course, there are steps being taken by the government in infusing professionals, but it's still a little ad hoc and it has to be done in a more systematic and institutionalized manner. So there needs to be a cadre of professionals that's created for these kind of grassroots level services. So which would actually improve a lot in implementation of programs at the last mile. And if you specifically talk of nutrition, of course, the concepts like the Nutri Gardens and the zero budget natural farming has to be taken up on a wider scale, which would actually come out with a lot of cost-effective methods of coming up with nutritious food. So that also should be taken up as a drive by the government across the country. So these are some of the methods that we can do to improve the last mile delivery of these programs. So, and I think convergence is the key, convergence of all the missions at the last mile administrative unit, which is the key to implementing programs successfully on the ground. Thank you.